We're going to look at the wage gap now, specifically as it pertains to medicine. According to a recent study, female doctors make 74 cents for every dollar that male physicians earn. That's just one of the realities the Women in Medicine Summit is trying to change. The two-day annual event tackles the big issues of gender bias in the medical field, bringing together hundreds of women and men from across the country to deal with this. Joining us now, we have the president of Women in Medicine, medical oncologist, Dr. Shikha Jain. Dr. Jain, the attendees leave with skills that they can take home with them, and it creates communities as well. I know there was a special panel on the state of women's health with the Roe decision, teaching women how to advocate for themselves and advocate for patients. Can you share some of the skills and advice that was learned at the summit?
Absolutely. And thanks so much for having me on to talk about this important topic. So the biggest challenge is not only that women in medicine don't know how to advocate for themselves as well as they should, but also the systems within which we work are often stacked against us. And so some of the skills that are taught at this summit include negotiating for yourself, navigating gaslighting versus imposter syndrome versus bullying, figuring out if you're dealing with a whisper network where people are trying to sabotage you in your career behind the scenes. Also, we talk about mentorship and sponsorship and getting women to the next level and advocating to lift up the next generation. We also do a lot of allyship work. So we invite people of all genders to come to the summit. And we had many men this year learning how they could be better allies for their female colleagues and how they could work to advocate within their systems for real systemic change. Because we don't just need to work on helping these women get better at advancing, because that's really not the problem. The problem is the systems. And so a lot of the skills they learn are how to take this information back to their institutions and educate and empower people within the institutions to work towards systemic change that can make a real difference, both locally and nationally.
You know, I would think it's not just financial gap, a wage gap, but that also when it comes to being able to know your value and communicate it effectively in this field, it's about what shifts you guys work and what jobs you take on. Does it translate past money? Are some of the problems within the actual job itself?
Absolutely. So women in medicine are often voluntold to do a lot of the invisible work that's necessary to get these institutions up, keep them afloat, and get the institutions actually more money and help with retention. So especially during the pandemic, we saw a huge increase in the amount of invisible work that these women were doing. And then that directly impacts their ability to be promoted. It actually impacts their ability to get into leadership positions. We have a huge gap when it comes to women who are full professors, women who are deans, women who are chairs. So it happens in academia and outside of academia. We also see a huge gap in awards, and a study that came out of University of Chicago by Dr. Valerie Press showed if you just nominate more women for awards, they get more awards. So there's gaps all across the board. It's not just money.
I love that. When you nominate women, they actually get the awards. Doctor, we also hear that women of color are particularly underrepresented in the medical field, but actually have worse health outcomes and worse health treatment than white women. Can you talk a little bit about that and how we can change that?
Absolutely. So one of the things that we had this year was a state of women's health discussion. And the challenge is we see that Black women, maternal mortality and morbidity is much higher. And there are numerous studies that have shown that when leadership and when the physicians treating the patients look like the patients they're treating, outcomes are better. So we had a huge focus on women of color and how we can get more women of color into positions of power and how we can get more women of color into medicine and promoted so they can be the decision makers, so they can help address the fact that we are not serving our underserved communities the way we should. And we need to have representation at every level so that we can make sure those patients are getting taken care of and we don't have this huge maternal mortality gap.
President of Women in Medicine, Dr. Shikha Jain, thank you very much. And we'd love to put your findings from the summit on the Know Your Value website. So we'll be calling you. And thanks for being on Morning Joe. We appreciate it.